so far on the mobile syringes and school buffers bill is that Senator Drazen wants to impose a buffer zone on the distribution of harm reduction supplies. Um, we assume that this is going to be 1,000-foot rule around a radius, like radius of a school and or daycare. That's what it was in her previous bill, although she has not specified what exactly she has in this bill, but we're assuming it's 1,000-foot rule. Um, and she wants to provide the ability for individuals to sue entities that leave behind, or I guess not just entities, she says those that leave behind biohazardous litter in school zones. We also got a few more details that she is planning to make this apply to mobile um, paraphernalia entities, not brick and mortar. So sometimes local public health is within 1,000 feet of a school and distributes clean syringes, for example. This may also still be problematic. We may still want to ask for an exemption for local public health, since local public health is licensed by the state, to exempt local public health mobile units from this buffer. So the problem Senator Drazen is trying to solve is a Portland neighborhood problem. The neighborhood around the stadium where the Timbers play apparently is a very well-to-do neighborhood, and they are very vocal, and there's a lot of open air drug use around the schools that exist there. I'm sure the problem is elsewhere, but these are the folks that have been very vocal and have gotten her attention. So we'll see what happens. Chloe has not taken a stance on this particular bill yet. I'm sure we'll have an amendment request that we will want to put in order to allow this bill to move forward. We'll see. I think given that Senator Drazen is running for governor, we will, and she's the, now a senator and is, very much a leader in the Republican Party in Oregon. I think we'll want to strategically want to try to work with her on this to make the bill workable and not harmful. But we'll, like I said, we won't really make a decision until we see the language of the bill and can really assess it fully then. But we know that something along these lines is coming. We also know, thanks to the Willamette Week, that the grocers are bringing forward a bill to allow grocery stores to sell cocktails in cans. Oregon is a controlled liquor state, meaning that only hard liquor can only be sold in state-sanctioned liquor stores that are licensed by the OLCC. The grocers are trying to erode this regulation by putting forward a bill to allow them to sell canned cocktails in their stores. We will see what happens with that. I can almost guarantee you that Chloe will oppose that bill. One of the strongest public health policies we have in Oregon is that controlled liquor system. So I don't know what legislator is bringing that forward. I reached out to one that typically will bring forward alcohol business bills, and I haven't heard back yet. So we shall find out. I don't know anything more about it than that the bill is coming, because the Willamette Week didn't go into great detail on what is in the legislation. We also know that the American Heart Association is bringing forward two bills that did not pass in 2025. The first is universal free school meals, which you all are probably aware when a kid is sort of qualifies for free school meals, it kind of puts a neon sign on their backs. And so making school meals free to all students really levels the playing field and reduces the stigma. It also, the bill also updates nutrition standards. So hopefully the meals will be healthier. And Chloe has not taken a position on this bill yet, but I imagine we will support it in some way, um, because it's very hard to learn if you are hungry, and we know that health outcomes are largely driven by education levels. So getting kids to be able to listen and learn in school starts with having a full tummy. Um, the American Heart Association is also bringing forward another bill, another recycled bill from 2025. This is defibrillators in schools, AEDs. Previously, it was House Bill 2529. So the American Heart Association wants schools to have a plan in place and to have at least one of these defibrillators accessible. Right now, they're usually in a locked case somewhere, and making it very hard for anyone who needs it to get to it. And so it's kind of missing the point. Um, this bill kind of uh, got hung up somehow in Ways and Means last session, as did, pretty almost all other bills. And so I think they may have a way to um, make it so it does not cost money so that it can pass this session. Again, Chloe has not taken a position on this bill yet, but we will be considering it soon. And American Heart Association is usually the leader on any tobacco related legislation. And just to let folks know, they will not be bringing forward any tobacco legislation in the short session. It became very clear in the long session that we do not have the votes currently for a tobacco flavor ban. So we're going to have to wait and see how elections shake out next year and see if that changes the calculations at all for votes on that. And then lastly, the Oregon Primary Care Association is bringing forward a mobile pharmacy bill. And I have a few details on that I can share. So they're really trying to solve the problem of pharmacy deserts, especially in rural Oregon. So they are proposing that in order to be eligible to have a mobile pharmacy, it must come from a critical access pharmacy, a hospital, a federally qualified health center, or a county government. The idea here is that we don't want big box entities coming in and putting mom and pop pharmacies out of business. That would miss the point. And so they want to make sure that they're being placed in areas that really need them and are not overtaking brick and mortar entities. So then they have just they have some details bulleted out, which I think you probably don't care too much about, just around regulation and record keeping and that sort of thing. And then it does have, though, it must establish and maintain a communication plan with local public health authorities to ensure required pharmacist reporting of communicable diseases. So, and then these entities will be governed by the Board of Pharmacy, and the Board of Pharmacy shall make rules around the operation of these entities. And then it does specify that mobile pharmacies shall not operate in one place for more than 10 consecutive days or operate for more than 14 days in the same 5-mile radius. And that is what I know about that piece of legislation. And that is really all I know in terms of the public health bills for 2026. So I can stop there and try to take questions, although I probably won't have the answers.
Thank you so much, Sarah. I really appreciate it. That was great. I want to make a quick note about time, just one that we're running behind our agenda. But the announcements and updates last section will also be kind of truncated naturally. And that what we're talking about now really does flow into the PHAB retreat continuation and review. So want to be conscientious of time while also knowing that this is really important stuff and it kind of flows together. Heather?
Thanks, Colleen. Yeah, I think this is really informative and will help kind of next year when looking at kind of FAB priorities at the local level. Um, Sarah, I don't know if you want to chat or talk at all about public health modernization, because that's a topic we talk a lot about in our local FAB, and do a lot of advocacy for. And I know it's a short session, so my understanding is we're just at a CLO level hoping for status quo on public health modernization because it is in between the biennium, I guess. But I don't know if there's anything you want to add to that.
Sure. So the because of HR1, the implementation of that is very costly, and so the legislature will most likely have to make cuts to the budget that they just passed to accommodate those implementation costs. Um, the good news is that the deficit that they were projecting has dramatically decreased. The bad news is that could change again before we have a final budget. And all of the agencies, including the Oregon Health Authority, have put forward cuts lists for places where the legislature could make some cuts. And public health modernization is on the list. It's far down the list and it's $10 million. $5 million of that is out of the CBO grant funds. That money was previously set aside by OHA to essentially try to mitigate any federal funding cuts that we were thinking were coming in this fall budget bill. But since they passed a continuing resolution, which means we're flat funded for the next couple of months, we don't really know what the outcome of that federal budget bill is yet. So that $5 million would be a very easy cut for the legislature to take. However, the other $5 million will probably come out of local public health and tribes and a little bit out of OHA. So we are proceeding forward with a no cuts to public health modernization stance and are really going to try to talk to the leadership of the legislature and just specify that that is penny wise and pound foolish because we all know that public health reduces healthcare costs through preventative efforts, through vaccines, through early detection and early treatment, and containing diseases through that surveillance and management, right? So our hope is that they will see the wisdom in that and not make any cuts to public health modernization. And then in the long session, we will also probably consider flat funding a victory if we can just hold steady through the duration of this federal administration. Because the things that the Trump administration is doing have ripple effects, right? The tariffs, Oregon is a big import-export state. Those tariffs impact our economy and make it so that the Oregon legislature has less money to spend as a result. Um, so we'll stay open-minded and see what the revenue forecast says over the next year, and then hopefully we'll see. Yeah, we'll see if we go for flat funding or if we ask for a little bit more investment. But flat funding would be considered a victory just as much as new investments would because of the environment we're in.
Thanks, Sarah. That's sobering. Commissioner Chang, did I see you raise your hand? No.
Sarah answered my question.
Okay. I have a question that I'd love to hear from both of you. Sorry, both Rick and Sarah. If you had a magic wand, like what kind of actions or like how could a countywide public health advisory board like us support the advocacy work that you're doing or make an impact? Like what would you wish that like we took on or that we did? If there is one.
Sarah, I think I better let you start.
Thanks, Rick. I would say, well, first of all, email your legislators and especially with the message of no cuts to public health modernization. And I can work on providing a template for you all to send, but it's really is best when it's personal and to your legislators. And then, if you all wanted to organize a letter for the entire PHAB to sign to send to legislative leadership saying no cuts to public health modernization, I think that would be very welcome as well. And that's really all I have for this moment in time, since we are in some weird times.
Yeah, I mean, I don't really have much to add there. Working together, um, legislators hearing for their constituents, which includes like units of local government, makes a big difference in the Capitol. And so they see us all the time. But hearing from you directly is much more powerful, I feel like. And so I think I'm in agreement with Sarah here, is to work together, be personable, and communicate often. So
Thanks. Heather?
Can I add to it, Colleen? As someone who I'm now CLO vice chair, and I would also, yes, add that. So there's the reaching out individually to your constituents, and then there's also when Tom or I come for requests from PHAB, sometimes that's pretty fast turnaround. And then our process here locally, as you all know, is we have CLO who advocates for all local health departments. And then when Sarah needs someone to testify or any type of testimony comes to the health departments, and then we need to get approval from our Board of County Commissioners to do that before we can do that. And so I think, there's a process by which we work through, but sometimes we have to be pretty fast in that process. And so I think this was great, Sarah, to give an overview of kind of what's coming in this next short session and what we could potentially work on.
So my question was something that comes up from time to time in these meetings, and that's whether when we're submitting letters of advocacy, like during public hearings, is it more valuable the content of the letter or volume of multiple letters being sent? Like, is there one that's weighed in a little heavier than the other?
Well, I would love to hear what Rick has to say after this, but I think the volume is more important than the content, because I actually don't think that the legislators read all of the online submissions. I think they do a quick skim and say how many people are in support and how many people are opposed. And then, if they're looking for talking points or something, they might pull up one or two letters that, that they could pull from to, have some talking points or to write a newsletter. That's my answer. I wonder if Rick disagrees.
just sorta. I think volume and uniqueness are both important, because I wouldn't say that I would do this, but I'm sure there could be lobbyists that could point out to a legislator that every response, every written testimony piece looks the same, and it looks just too orchestrated to be like personable. But if you have different letters saying basically the same thing, but in different ways from different parts of the state or different individuals, I think that tells legislators and staff that there is a lot more interest. It's not, I guess, astroturfed, I guess, if we want to use that word, right? Like it's like real grassroots as opposed to fake. So I think it's both. But yes, definitely volume does make a difference initially, I feel like.
Thank you. Commissioner Chang?
Thanks. So Heather basically gave us a sense that there might be some key moments where we need to be on high alert to be able to turn around PHAB support for a letter really quickly. And I would love to hear from Sarah and Rick, if you could predict with the short 35-day session coming up, what those weeks we need to be on the high alert are. And it's obviously much harder during a long session to, because you are going to need to be on high alert for a much longer period. But if with a short session, it's like, after you get your protect a public health modernization letter out, be ready, the week of February 28th, um, in case something comes up. Uh, that would be helpful for us to know, because then we could just make sure that the PHAB isn't on high alert all the time, just in a very focused way.
Rick, go ahead. You can take the first shot.
Yeah, I mean, with the short sessions, you really have to have almost a fully baked concept by the first hearing. So like that first week of session, if a concept isn't really ready by then, it's probably not, there's not time to amend it. So I think anything ahead of, probably the first day of session, right? To have a sense of what the draft looks like, because people will start sharing drafts, I think, fairly soon. That's probably, I think even before the short session starts is really the best time to influence what legislation is going to look like. There's really no time otherwise to fix it in a short. Now, a long session, different, right? You have up to 160 days, although there's committee deadlines that get in the way. But I feel like getting a handle of it sooner, before bills are actually first read, is going to be the most advantageous.
Yeah, I agree. I think in a short session, especially for, what I'm asking for, I think you can prepare a letter to come from PHAB during the month of December, and then maybe PHAB can take a look at it in January and make any changes and approve it, and then it's ready to go for session. I think because I think legislators are they are looking at the cuts list now. They are probably prioritizing what cuts they will make in what order now in through the end of January, and then that way when they get their final revenue forecast, they start checking things off the list and making those cuts. So this, sooner we can have those no cuts to public health modernization letters in, the better.
Thank you. I know there's a whole lot more questions. Dr. Fawcett, did you take yourself off of mute? If it's something that can be short, I'd love to hear it.
I think I'm off mute, but I didn't have a question. I'm sorry.
Oh, okay.
Yeah.
No.
But I want to thank you for making the edits on the minutes for the retreat. Thank you. This is a great presentation. I'm making my own notes. Thank you, Rick and Sarah. Thanks.
I know I'm supposed to have the next agenda topic, but it's really hard to interrupt all this great content. I do want to segue, because it does feel like a natural point to kind of bring what we're hearing from here with what Tom had prepared. So I was going to review the notes from the past retreat, but I would just say that if you weren't at the retreat, it would be great to go back and spend some time reviewing the notes. They were really great notes, I thought, that captured a lot of the feeling of what we were talking about. But two of the main takeaways we had was an interest in PHAB doing some collaborative work to identify who is doing what in the region, like a systems mapping type of exercise, motivated by the fact that with these budget cuts and financial scarcity, that we are all public health. And that was a message that we had heard and reiterated from Heather, and the importance of identifying where there's potential duplication or areas of collaboration in the community that are happening. So that systems mapping is something that has been emailed about. If you're interested in being part of a small group to kind of form up what that process might look like, please reach out to me and Tom. I know Sarah Barron is really interested in it, but I'm picturing a small group that would meet once or twice, so like minimal work, but would just love to get some other eyes on what that process might look like, because there's a lot of energy around following up on that from the retreat. So if you have capacity and interest in being part of a small group to meet once or twice, we'd then bring back the next stage of this conversation in February. But getting back to one of the other two priorities from the retreat was on PHAB's role as an advocate. an advocating body. Thanks for that contact info, Rick. So one of the things that came out of it was an ask from the PHAB members to Tom to kind of frame up a process by which we were notified of opportunities to advocate. And that was kind of like some of the concrete next steps, where it would be taking what we're hearing about from CLO to public health leaders to PHAB, and what that like notification and sign-on process looks like. So Tom, if it's okay with you, can I pass it to you for maybe previewing that, and then we can maybe ask questions while we've got the experts in the room?
Yeah, and I can make it pretty quick so we can devote a little more time to the systems mapping because this is a little more straightforward. So I'm just pulling up, I created a document based on the feedback from the retreat, just talking about that we will have a process in place. I even have the same definitions about long and short session that we heard there before, because that's sometimes good to keep in mind as we do have a short session coming up here. So definitely not nearly as much time to advocate, and important to really get ahead of things. And then I outlined a process here, and I don't know that we need to go through it step by step right now. I could always send it out and ask for feedback on it, but it just kind of outlines the different things that I do. That, you know, I'm the co-chair of CLO, which Sarah is the director of, legislative co-chair of CLO. And so I'm very connected at that level. I attend the commissioners' weekly meetings, so I have opportunities to recommend positions on bills. And then if the commissioners are in agreement with my recommendations, then that is something PHAB can go advocate for, representing themselves as PHAB. And just basically, I'm to keep up on the process whenever I get informational emails, like say from Sarah Lochner, you know, I can forward that on to you. And I also usually put together some lists of bills I'm monitoring regularly. So in between our PHAB meetings, I can just kind of help keep you more informed. And I also ask that members, if you hear about a bill that maybe we haven't discussed or you haven't seen, you know, shoot it my way. And, you know, that's something I can look into deeper. So anyways, one other thing is, the one question I had here is, for our letter templates, do we want all our organizations listed with our names, or just our names as PHAB members? The one thing I did think of is that, you know, if your name's going to have your organization on a letter of advocacy, you probably should make sure your organization agrees with you on it. So that would be just one concern if we put organizations on the list. But anyways, I'm open to it. Yeah, and just being, when there's an urgent need, I'm just going to send an email that's, you know, with the subject line, approval for advocacy needed by this day, in big capital letters, and really wanting quick feedback. And if I don't get feedback, I'll just be assuming that you are supportive, you know, depending on how much time we have to submit a letter or whatever we're going to do. And also, you know, PHAB members can also testify. Now you can testify virtually, so you don't have to make the trip to Salem, and it's very convenient and easy to do. So that's something PHAB members could also do. Anyways, I kind of sped through that so we leave more time in the agenda for the systems mapping. Are there any comments, though? Oh, yeah, go ahead, Heather.
Yeah, so I guess I am curious, question to the PHAB members, that the question that Tom raises, like, I think it could be pretty powerful to have organizations listed on there, but I'm also cognizant of, I don't know your approval processes, but maybe that's something you have to take back, but I'm just curious what you all think around that.
For me, I'll just jump in on that, Tom and Heather. I'm representing Mosaic here as the federally qualified health center. So I would advocate that we could put our logo on it, as I wouldn't be able to support it without support from Mosaic. So I'm representing our organization here.
And Wendy, a point of clarification there that I think might be what Lindsay is also going to bring up. When you said that you wouldn't be able to support it without Mosaic support, do you mean that you would have to seek internal approval on whatever set that was? So I guess that's where my concern is, that having to seek internal approval for those of us that would have to do that could mean slowing down the process. So it's kind of like the speed versus organizations being listed.
Yeah, I'll just, I think for anything that's time sensitive, I have pretty good access to like our executive leadership where I would be able to get something turned around by end of day, or at least a decision on it.
Lindsay?
I would add just a counter perspective on this. I do think that being a little bit larger of an organization, we could actually prevent moving forward in a really speedy manner. And so in the past legislative session, my leadership was comfortable, of course, with us supporting this work, as I am a PHAB member by name only, but not, but I think with the request of including the organization name, it would require some additional vetting internally. And I would be really uncomfortable holding up any process. And if this was the decision the PHAB would like to, the direction the PHAB would like to take, I would just request perhaps leaving my name off, because I certainly wouldn't want to hold the process up just due to the vetting that we would be required to do.
Thanks, Michaela.
Yeah, similarly, it would take me a little bit of time to get internal approval for any of the bills.
I think maybe we have our answer.
Heather, we did, I guess, talk briefly during the last meeting that perhaps that same letter, though, could be utilized by individual organizations, and just, you know, we include our own organization name and send that as well. This was, I think, a part of our discussion in last month as a way to get around that, which I think could be helpful.
Yeah.
Yeah. And I think that point was one that we had brought up as well. And it kind of gets to what Dr. Marie was asking in the chat about a good place to see position points for and against legislation, where if we had talking points, it might be easier for us as individual organizations or citizens to draft a letter with the points that are already like reflected and vetted by Chloe.
Mm-hmm. And so I could always supply a letter from PHAB and then also the talking points. So it could be like two separate things. I do often notice when I look at letters submitted online that many of them have the exact language with just different signatures. So that does happen a lot.
And I would add that I think, and I know it's hard because we're all so busy, but being able to add something personalized from within your organization that shows the importance of local public health as with regards to your agency, I think could be really powerful as well, whether it's testimony, written or verbal.
Well, Colleen, maybe we could move on to the system mapping, and I will send out my document to everyone so you can take a look at it and just see if you think I missed something in there, and or you have any ideas. I am very open to any suggestions.
Great. Thanks, Tom. Yeah, you know, to be honest, I don't know that I have a whole lot right now to get into with systems mapping here. I think it would be more of an offline conversation in between meetings, so that we had a small group that was really being really intentional about framing up action items for the full membership at our February meeting, because we don't have a January meeting. But again, the motivation was to identify gaps in areas of public health, or both gaps and really more so areas of potential redundancy and overlap. So looking at like who's doing immunizations or public communication about communications, and vision would be to support and identify what the Deschutes County Health Services is doing, but also the CBOs that are doing similar work within their own contexts. Lindsay, can I pass the baton to you just because I heard you explain it really well when it came to the environmental concerns and Pacific Source's role with smoke and fire?
I will do my best. I think when we were really talking about the systems mapping, it was really trying to identify areas of opportunity for us to lean in and support one another in a constrained environment. Heather and I have had really lovely conversations where we've learned, oh, my organization does this. Oh, mine also does this. So how might we work together to identify those areas where there is some shared work? So maybe, Pacific Source might be able to take some aspects of, communication strategy during an environmental smoke hazard that might offload a little bit of work for Heather's team so they can do other work. And so really just trying to understand all of the different levers of each of our roles and work in the community so we can support one another when things get much tighter. Is that helpful? Is that the direction you hoped I'd go, Colleen?
Yeah, that's perfect. And I know that you and Heather have had conversations about this. And just every time I've heard one of you express it, it's better than I can. So thank you. Yeah, Heather.
I would just say thank you, Lindsay. Yeah, we've had a lot of conversations, and I would say one example that was really successful that I really want to thank Mosaic and St. Charles on was the vaccine PSA that was done in September. We came together as a group really fast. And, St. Charles was able to provide a lot of the behind the scenes work to get that produced. Mosaic really kind of got us all together. Dr. Fawcett and others were on that as our providers. And it was just a wonderful example of kind of coming together to provide different resources in a time, with that's constrained right now. So I just wanted to share that example.
Thank you. And just for purposes of the notes, I want to reiterate the folks who I heard were interested in the chat, that was Heather Keisner, Wendy Jackson, and Michaela Arsenault. So maybe we can get together. Gosh, we're almost getting into the holiday season when everything goes crazy, but hopefully in the next couple weeks, and reach out if you weren't on that list and want to be added to that. And the idea also was it being that the systems mapping work would inform future agenda setups of PHAB meetings, that work would be incorporated into each meeting. So it feels like we're building upon the efforts, both like in the systems mapping exercise itself and also in like the monthly recurring work that we do together. Great. Thanks all. I think we can open it up for any member announcements and updates. Well, if you think of one, you're welcome to email the group. Also, Tom, did you have anything you wanted to say about the vice chair follow-up? Otherwise, I can make a plug.
Yeah, all I was going to say is that we still do not have a candidate interested in nominating themselves as vice chair of PHAB, and it is an important position to have because sometimes the chair can't make the meeting, and it's very helpful to have at least someone as backup to support it. Like today, Colleen was still as vice chair able to take on the agenda. There is a little more work with the vice chair as far as like meeting in between meetings. To work on agendas and also some strategic planning, but it's not a huge amount of additional work. So I just want to throw it out there, and I realize there are many new members on the group, but we don't want to limit a vice chair that it has to be a member that's been around for a few years. We're definitely open to any new members who are interested in doing something like this.
Great, and I made the best recruitment letter ever. So just read the letter and you'll be convinced, or at least have a specific idea of the scope of what's being asked of you.
And we have a lot of support internally with Tom and Amy, so we don't want to make it a big lift.
Well, think about it.
Yeah, no, we're not asking for hands right now,
Yeah.
so we can take that pressure off. But maybe we can go ahead and move on to the 2026 meeting calendar.
Yeah, so basically what I wanted to let everybody know is that I will be sending out all the meeting invitations for 2026 probably by the end of this week. Just in case things come up, I kind of wait until closer to the end of the year to send those all out. But the first meeting of the year will not be until early February, and because the first January meeting will always fall right after New Year's, and that never has good attendance. So look for those meeting invites, and please just accept them. If you happen to see the first meeting on the invite is a date you're not going to be there, if you decline it, then it'll just decline all the meetings. So just accept them and then go back in individually to do that. And yeah, that's all I had for that. And the last item.
Although, Tom, is
Yeah.
it possible, this is maybe a technical
Yeah.
question, is it possible to have the calendar invite indicate whether it's in person or in Zoom, like in the
Yeah, I
in the
have been doing
location?
that.
Okay,
I
I should
started
just
doing it
notice
the
them.
second half
Oh,
of this
okay.
year, but I have to send different invitations. So you'll get a series of different invitations from me um, in order to set up those calendar invites with different subject lines and so forth.
Gotcha. Thank you. Said or asked as someone who has been in the parking lot taking a Zoom call because I made that mistake.
Yes,
Thank
totally.
you.
Then, yeah, I texted Rob, and he's usually good at getting back with me, so I'm not sure what's going on. Um, thought he was going to be at this meeting.
Yeah, so I know we sped through some of the legislative information and now have extra time. Um, I would be really interested in just hearing a little more from Heather about Flo and leaving your new role as the vice chair there. Like, what is Deschutes, just like as somebody who doesn't know, one, like, how does CLO identify their priorities and positions? And what does Deschutes County's role look like with CLO?
So Deschutes County, so every local public health department director or administrator is part of the coalition of local health officials. So we have the Conference of Local Health Officials, which works closely with OHA around kind of our statutory required programs and funding, federal funding, those kind of things. We have a training review process that's kind of like an audit of our programs. That's more the conference. And then we have the coalition, which is more around advocacy. And so it's kind of what Sarah did today. I mean, she's our advocate, kind of lobbyist with it for public health, local public health in Salem during legislative session and outside of legislative session. So she brings those, and Tom is on the subcommittee for CLO, and we meet once a month as a big CLO, and the CLO subcommittee kind of brings those legislative priorities up to Big CLO, and we vote on that, on what priorities we want to take as a CLO overall, that Sarah then goes and kind of advocates for at the within Salem. So that's kind of how that works. A lot of the focus has been public health modernization, obviously. We're now almost 10 years into public health modernization, which I can't believe. We've done a lot around nurse home visiting programs as well as substance use prevention and overdose prevention work. So I just started as vice chair, so that was last month, so I can't really tell you much yet. So yeah, so I think as vice chair, I will myself and chair, which is Carrie Brigiotti. She is from Union County. Will probably be asked quite a bit to testify when we're able to in Salem. So that's kind of part of that process. And then, it's kind of what vice chair would be here too, right? Like meeting in between meetings and coming up with agenda items and things like that. I also wanted to just briefly kind of talk about, I'm also on the State Public Health Advisory Board. That's a different group than CLO. And so that's being appointed by the governor, and I represent large counties. So I have a seat as a large county on the State Public Health Advisory Board. And what I think is exciting is the conversation we're having here is very similar to the conversation we're having at the State Public Health Advisory Board level, especially around kind of the systems mapping. We just had a retreat last month as well, and talking a lot about trying to understand the whole public health system, within that being governmental public health, but all of the other systems that play a role in it, and how do we leverage and partner better in these times that we're heading into of constraint and limited resources. So a lot of talk around that, and then a lot of discussions around priority setting for PHAB, and really focusing in on kind of what Sarah was saying about how do we stay the course with modernization and not get cut at this point, and how do we, they're calling it a refresh of modernization. I will be fully honest, in those meetings, I talked a lot about, I struggle sometimes with the word modernization. I would rather just call it essential core public health services. Like, that's what we're trying to hold on to here, and just be pretty frank about it. And so we're having a lot of conversations about what are the key messages, what is our strategic communications regarding modernization. And you'll hear me keep saying, to me right now, public health modernization is being able to assure those essential public health services in every local public health department. And we can't do that without our partners. So that's the work we're kind of doing at the state level right now, but it's really trying to just stay the course as much as we can, which sometimes can be depressing conversations. And at the same time, I always try to find innovation in it as well. So is that any other more specific questions, or that's what we're doing? But I appreciate you all, because I do think what we're all doing here locally is really important, and we need to continue to bring that advocacy and that vision and how we work together, and not just Deschutes, but in Central Oregon. Because I will tell you, oftentimes I'm at those state tables and they look to Central Oregon as kind of a model in how we work together between agencies and between our CBOs, our healthcare providers, and our local government. So I think we need to keep pushing that message that we do innovate here. And so I think that's going to be really important moving forward.
Absolutely. Thank you so much, Heather. That's really valuable. And it also makes me think that maybe the systems mapping we're doing, that I'm sure there's elements that we could learn from other folks at the state or other county levels who are doing something similar. And also maybe an opportunity for us to show that Central Oregon is a trailblazer in a way of doing this, or like set a model that others could emulate.
Yeah, I have a feeling we will be the innovator on that one. We'll probably get it done before anyone else.
Before we wrap up here, Commissioner Chang, did you have any local context or anything to add as far as Deschutes County's hopes or concerns going into the short session? I don't know if there's any tie in there looking at budgets.
Couple of the things that I'm tracking more closely looking at that short session are just some policy discussions about transient lodging tax collection, and what it can be used for. That are that basically local governments are looking for more revenue to provide a variety of different kinds of services. But it might come out of the hide of the tourism industry or tourism promotion organizations. So there's going to be some. It's a delicate dance that's going to have to happen there. There's also going to just be a lot of drama around transportation funding. There was a small transportation package passed by the legislature in short session in September, and now there's a very active effort to repeal that transportation package through voter ballot measure that's moving forward, basically putting the funding for basic operations and maintenance activities, snow plowing, ice removal, pothole filling, getting debris off the road, things like that, putting those basic operations and maintenance functions at risk. So I expect that those two things are going to take up a lot of attention. Just also kind of cross the board cuts for state agencies that might come out of reduced revenue forecasts and just kind of lost federal money. Um, the, so those are it's short session. I mean, dealing with any of those things could take up a big chunk of the time for a lot of legislators.
Absolutely. Well, thank you so much for that update, and Heather for the context. Also, I think that it looks like we're heading into, and the conversations are like kind of similarly sobering, maybe panic inducing in the housing world that I'm in as well. And I just want to, I don't know, echo that I think we're all feeling a level of uncertainty with the work that we're doing. And I appreciate that everybody is still stepping out of their lane to do this work together. So thank you so much for investing time and being part of this board. And I think be on the lookout for emails about advocacy as they come up, or just informational legislative info from Chloe. I think other action items for this group are to take a look at the retreat notes if you weren't able to join us, and at that menu of potential options, knowing that the work that we want to focus on is to promote group advocacy and on the systems mapping. And we'll reach out to schedule with the folks who want to be part of that. And if you do want to raise your hand for either a vice chair role or to do some of the systems mapping work together, feel free to reach out. Tom, am I missing anything else?
No, I think you covered it. Other than I'll start working on drafting talking points for supporting modernization over the next few weeks. So we have a start. And the CLO Legislative Committee meetings start this Thursday because we took a little break. But so things should start rolling out a little more regularly now than before.
Thanks, Tom, for that.
Perfect. Thank you. And we'll probably send around a virtual thank you card for Dr. Rob Ross. So keep an eye out for that as well.
Or maybe at one of our in-person meetings if he's available. He can come and have lunch with us at least.
Yeah. Well, I hope everybody has a great holiday season. I'll plan on seeing you